Hello, and welcome to the Health Data Ethics Podcast. I'm your host, Jenny Owens, and I'm back to continue our content on both artificial intelligence evaluation, so the evaluation of AI tech, especially in the healthcare space, and with a side note of BRM skills, because it turns out that several of your business relationship management skills are really important when it comes to evaluating artificial intelligence in the healthcare environment. And what I wanted to speak about in this episode in particular is the importance of shadowing, which is a really key BRM skill that comes in very handy when it comes time to kind of cut through the hype of the artificial intelligence marketing and really see what can these tools do for you in your own personal healthcare landscape. So when you're evaluating any tech use case, but especially for artificial intelligence, once you've heard your demos, you've heard your pitches, you have a good sense of what you think this product can do, the next step is to say, okay, so I've identified a use case for this. I have a business setting in which we want to use this. Let's go walk the floor. Let's go to the Gemba. Let's go do some shadowing. Let us build upon those relationships that we have with the folks who would be using this tool every day. This will allow you to evaluate the situation to kind of see if this tool will really solve the problem that you have. But when you do this, really the first step should not be, will this tool solve the problem? It should be to approach this shadowing in this area of interest with fresh eyes and to kind of leave all of your expectations at the door. So I think probably the best and the easiest example is way back in the day when I used to work with the lab. There are so many different laboratory management systems, so sample management systems, inventory management systems. Basically, any pathology laboratory is a giant rotating library full of books, except the books are tissue specimens or fluid specimens, chunks of, from resected from surgeries. And so you have quite a bit of physical material to manage. And it takes up space. You're required to keep it for at least 10 years, according to the College of American Pathologists. And yet you want to be able to lay hands on any particular bit of it at any moment. You could have the need to do so. So there's any number of people or of companies that are happy to sell you specimen management systems, any sort of software, really cool like RFID codes that you can use, 2D barcodes, all sorts of really cool things. And when I was working in research and pathology, I would occasionally hear pitches for this. And then I would go to our surgical pathology lab manager and say, hey, I just heard this really exciting thing. And I love our surgical pathology lab manager. He's a fantastic guy, but he would say, yeah, but have you seen the current system? It works. And that's really the kind of situation that you'll often find yourself in when you're evaluating AI or tech. When you're working as a BRM, you often find yourself with a solution in search of a problem. So once you have a solution that you really like, your goal is to go and see, okay, I think that there is a problem here. But let's put this all to the side. We're going to go look at it with fresh eyes, and I'm just going to see, how is the current system working? So in our historic hypothetical case, I would go down to surgical pathology and I would watch as we received in specimens. I would watch as they got coded. I would assist with the pulling of specimens. When we had requests come in, I would follow that whole process. And I would kind of understand, okay, here is our system. It is heavily paper-based. It's heavily paper-based because our archives are in the sub-basement of another building where we cannot reliably, we don't have workstations down there. It's not wired for good internet. Like, the system that we have works. And the thing that takes the most time is not trying to work within, it's not trying to find the correct case to match the correct specimen. It's literally, we got to walk and find the stuff. And there's no computer system that's going to make that geographical distance smaller. So as you are shadowing, as you are trying to assess a situation where you're trying to see, will this solution that I have found meet the problem that we have? First, you want to come in with fresh eyes and say, okay, let's look at this. Where are the time consuming points? Is the time being spent where I thought the time was being spent? Where are the pain points? Are the difficult things the same things that I thought were the difficult things? Are they the same things that this software or this application or this artificial intelligence, are they the same things that this fixes really well? So does our solution match our pain points, either in terms of time or in terms of difficulty? Um, as you're shadowing with a completely agnostic mind, watch where are people spending lots of effort and where is that not paying off. So lots of effort is fine if it pays off in better clinical care or cleaner data or like a good result at the end of the day. But if you're spending a lot of time and effort doing things that don't pass the sniff test, that's a good thing to see, okay, does this match then the technology solution that we are trying to develop or that I have in mind? And then last but not least, when you're thinking about effort, think about all the dimensions of effort. So think about physical effort. Are you physically walking from one building to the next to pull slides or blocks? Are you bringing back a drawer that might be full of paraffin or full of glass? It might physically be heavy. That could be difficult. When you're thinking about effort, think also about the mental effort. Am I doing calculations? Am I trying to retain a lot in my human memory? Memory and mental based effort is a great place for AI and for technology to come in and lift some of that burden because the holding information and making calculations on that information, those are things that AIs do very well. And then you might also want to think about the emotional effort, right? So if I have a task that is relatively easy to do, but my system fails a lot, so it's very frustrating, I have to try it 5 times in order to get this requisition to go through once, then that's a task that requires a lot of emotional effort. And that's a place where you might look for a technological solution as well. So in conclusion, when you're shadowing, try to keep all of your technical thoughts and your solution oriented thoughts in the back of your mind where you can reach them if you need them, but go in with as close to fresh eyes as you can. Really pay attention to the pain points and to where time is being spent. And when you're thinking about effort, think about effort on multiple axes: physical, emotional, and mental.